Alright. Hi there. So I'm Dr. Rhodes with Rhodes Equine Veterinary Service. It's nice to see you. My helper Mike is helping to record me in this, and he's going to try and pass along your questions if you have any while I'm doing this. So most of you, if you've had horses long enough, you've had a foot abscess at some point in time, and if you haven't, it's only a matter of time. It is the most common cause for lameness in a horse, a foot abscesses. And if you've ever had one, or a bad one for that matter, you know that sometimes these horses can get really, really painful. I mean, like, toe touching my leg is broke painful. So at some point in time, you're probably going to have to do the aftercare for one of these problems. I'm going to show you how to do a duct tape boot here, because that is a common aftercare deal that you end up having to do with these horses to treat for a foot abscess. If I dig a hole into their foot to release that foot abscess and to release all that pressure built up in there, you got to keep the dirt out, and you got to allow the medications to stay on there. So that's what the goal of our treatment here is going to be. So the first thing that we need to do is we need to make a duct tape square. I'm going to have Mike come on over here and get real close so you can see this. All I did was take some strips of duct tape and put them in a row like so. After I do that, then I take some more duct tape and I go in the other direction like so. And actually, honestly, if you ever see me make these, I usually tape it to my pant leg or wall or stall door or whatever else you come across. What you're doing is you're just making a nice square pad out of duct tape here, and this is going to help keep the dirt, the debris, and most of the water off that foot while it's trying to heal. It is important when you're doing this, because a lot of times these horses are painful, to have all of your stuff together and ready. So you have to. Making a checklist sometimes helps. And if you have a really obnoxious horse that likes to wear through these, like some of them do, you can put 2 or 3 of these together and make multiples of your squares, and that's fine. Alright, so I made my square, and I'm actually going to switch legs because I'm going to do this on her right leg. Alright, so the next thing you want to do, now ideally, if I came out there to treat your horse, you're just pulling the old boot off and replacing it with a new one. But if for whatever reason they kicked it off or whatever, you want to clean the bottom of the foot off. You might get some soap or water and just kind of rinse it off real good. You might need to soak it in some Epsom salts before you put a new boot on. You just kind of want to clean the surface off. And ideally, you're working in a nice dry spot, which we are not right now, but this is just a demonstration. So, clean the foot off. And then you go and you get your poultice. Now, there are dozens and dozens of different poultices out there. There's Ecthamol, there's an Epsom salt poultice that you can put on there. You're going to use DMSO and nitrofuracin because that's what I've got at the moment, and that's usually my favorite, but they all really work just as well. So if someone tells you to use something different or whatever, it's not going to make a difference. Just as long as you have some kind of drawing agent at the bottom of the foot, it's going to help draw that inflammation out of there. So have that. That's my poultice. And if you do DMSO and nitrofuracin, nitrofuracin is a carcinogen, so you make sure that you use gloves. Very, very, very important there. I can't hound on that enough. And if you get DMSO on your skin, you'll probably taste garlic for like a week. So don't do that. The other thing that you're going to need is you're going to need some kind of contact layer, so some kind of padding on the foot. out in the field, I am too lazy to carry other things around, so I usually have roll cotton, and I'll take a square of roll cotton or an animal latex pad, and I'll use that as my contact layer that I'm going to put on the foot. But what I will suggest to you, because these are super convenient, is a baby diaper. These are the best boots on the face of the planet. Their foot fits just right in there, and it tapes around. It's just the right size and shape for the bottom of the foot. So I'd suggest keeping these on hand. These are the best things in the world for this. So I've got my contact layer. I'm going to put my gloves on. I cleaned my foot off, and I put it down in a nice, dry, clean spot. Or we're going to pretend that I did. I pick this foot up. Oh, and I want my duct tape. Don't do that in real life. I got everything I need now. Checklist, right? Alright, so then what I'm going to do is I'm going to smear my DMSO and my nitrofuran on the bottom of the foot, like so. Then I'm going to take my baby diaper, slip it over that, and I'm going to remove that glove. And I'm going to find the little tabs around here somewhere. I'm going to put that on the bottom of the foot because it just fits there perfectly. And the next thing you want to do, since I'm not handling the DMSO anymore, is you want to take your boot. You just kind of want to put the foot in the center there. You want to push the edges around, like so. And then the final thing that I do, get my duct tape, and I just tape around there to hold it tight. Now, a couple of important things to keep in mind as you do this, and I'll go in both directions. Don't go above the coronary band, because that could potentially cut off circulation there, and we don't want to do that. So you just want to tape this to the hard part of the foot. Remember, we're just trying to protect the bottom of the foot from dust and debris and moisture. Let her put her foot down. I'm going to check my job. You can see the only thing sitting over the surface here is our baby diaper. Sometimes if I get over the top of the coronary band, what I'll do is I'll push this down and then I'll tape over to hold it in place. There's not enough extra to do that today, but that is a duct tape boot. Some maintenance things to keep in mind. You do need to actually pick up the foot every day and check the integrity of your boot, because they like to wear through right in this spot right here, right at the toe. And you can't see that from when you're leading the horse in, or in the when you're just checking on them in the pasture. You need to actually pick up, check the bottom of the boot and make sure that that toe is still intact. And if they look like they're wearing through it, or they're wearing through it really quickly, something you can do, you can just take some extra strips of duct tape and you can just take that over the toe, and you can put as many of those right here as you want to reinforce that toe if they're running through it really quick. You can leave this on there. I basically tell you until it wears off as far as protecting the bottom of the foot. You might have to replace it 2, 3, 4 times, just depending on how big of a hole got cut in there to release that foot abscess. But that is about the result of it. That's how you make a duct tape boot, and that's how the aftercare of treating a foot abscess. All right, thank you.